Chronic obstructive pulmonary disease, or COPD, affects over 46 million people in North America. But how many of their stories do we really hear? I'm Dr. J. Rutland, and today on the Health Exchange, we're joined by Tom Gill, a 90-year-old man navigating life with this chronic condition. From shortness of breath to moments of unexpected strength, Tom's story is about living with COPD, but also about aging with grace, humor, and resilience. The evolution of management of COPD has been fascinating, with new understanding of how the environment impacts the immunology of our lungs. You guys know I love this, so let's get into it. Tom.
Yes.
So one of my greatest regrets is I didn't spend enough time having conversation with my grandparents. And I really appreciate and respect the fact that you're taking time out of your day to have this conversation with us. So really, honestly, sincerely, thank you for joining us today.
Well, thank you. I appreciate that.
Tom, where are you from? Where did you grow up?
Well, I was born in Ohio, and we came to California in 1943. Came here on my 9th birthday, so it had been 44. And I spent the rest of my life in California. And both my parents smoked. So I was probably exposed to COPD during my childhood days. But I never smoked until I met a girlfriend. And after I got out of high school, I went to work, and she smoked. I thought, well, I guess I ought to smoke too, because I couldn't stand, even though my parents smoked, I couldn't stand the smell of smoke. But I tried it, coughed and hacked, and finally got used to it. And I smoked for 25 years after that.
All about the girl, as always.
All about the girl.
So when did you first start taking the puffs of the cigarettes?
Probably 19.
19?
19 years old, yeah.
And then you smoked until you were, what is that? Plus 20 is 39?
45. I was 45 years old when I quit.
How many cigarettes a day did you smoke?
Oh, about a pack and a half.
Pack and a half a day?
Yes.
So about 30 cigarettes a day?
Yeah.
For 25 years?
Yeah, and it never affected me during that time. I was always very speedy, I didn't feel anything. Just, everybody said it was bad for you, but I was married, had 4 children.
Wait, you married that girl?
No, I didn't marry that girl.
Oh.
In fact, I married a girl with 2 children already.
Oh, wow. Okay.
And then we've now been married 63 years. So anyway, she had a boy who had asthma, and I always smoked around him. And one day she said, you're coughing an awful lot when you wake up in the morning. We ought to have you quit smoking. Okay. Well, everybody says you can quit 100 times, but you really can't. So I got on a program where I quit smoking and haven't smoked now for another 45 years.
That's amazing. That's wonderful. I have a question for you, because it's not every day where I get a chance to sit and talk with somebody that was born in 1935.
Yes.
I mean, 1935, it's 2025. The world was vastly different.
Oh boy, as it ever.
What were the 3 major differences? If you have to think about it, what are the 3 major differences between the world then and the world now?
Security, probably one. You could always we didn't have fences. The kids could play outside, and you never worried about me walking to school or my kids walking to school. As things progressed, it got worse and worse and worse. Progress, you got telephones now, which we just had the old dial or ring, and all that kind of stuff, And I would probably say, of course, our GPS now is quite a invention. In fact, I worked on that for about 15 years. You
worked on GPS?
Yes.
On the maps that we have on our phone? That was you?
Well, I actually built the components that went into that to put into the satellite, which went up and did that, yeah.
So you built the components that were required to be delivered to a satellite, so the satellite could tell our phones where we were in space.
Correct. But the satellites were actually built here, and the satellites went up. So we had a division in Anaheim that built all the small boxes, like the navigation, all the other components, and then they went to Seal Beach. They put it all together. They had it in a chamber where they could do 10,000 miles up in the air. And then we had our first launch in 1977. Supposed to last 3 years. It lasted 9 years.
So you were an engineer? Is that what?
Oh, I was a project manager that oversaw a certain amount of boxes that we put together. There was actually 4 of us that were project managers.
When you guys were doing all of that, was everybody smoking while they were building these boxes?
Oh yeah. Everybody was smoking, but you didn't smoke. They quit smoking in the building I don't know when the Surgeon General came out with smoking was bad for your health, but I was smoking, then. You could only smoke outside at that point. You couldn't smoke indoors.
When you were growing up, did you ever see ads where doctors would advertise that smoking was good for your health?
Never.
Never. So you
Never.
never saw any of that. So they
No,
never
no.
advertised that then.
Of course, when you grow up with a smoking family, it's my mom and dad and all his brothers and sisters and all that, everyday normal thing. But like I said, I didn't start. I loved sports, so I didn't want to fool myself with smoking. Although I noticed my dad started breathing a little bit heavy. He was a professional boxer at that time, back in those days. And anyway,
Your dad was a professional boxer in the
Yeah.
early 1900s?
he quit. I was 4 years old when he quit. That would be 1939. It's really a strange story. If you want to hear that.
I mean, I want to hear how a professional boxer smoked every day. Yeah.
It was amazing. My dad smoked. My dad drank. My dad caroused around with, he was not a faithful husband to my mother. But he jumped rope. He hit the bag. He taught me how to do all that kind of stuff. But he was good. But strong man. But after a while, he had to quit that. And then, of course, the depression and so on and so forth, and the war. And Mom got after him. And so anyway.
Did the Great Depression affect your family?
Of course, I was so small, I didn't really tell much about it or feel much about it, but I think it affected everybody during the Depression time. My dad came from 11 kids in his family. My mom was an only child, and I was an only child.
So you knew when you started smoking, you knew that smoking was bad for you. You felt it was bad.
Well, not for the point of health-wise, just smell-wise. And, who wants to keep buying cigarettes and burn holes in your clothes? And
How much did they cost when you bought them back then? Do you remember?
well, you a quarter a pack, and you get 2 cents back. Had a little package that you'd open up, that'd be 2 cents. It was in there, 2 pennies. In those days, they didn't have filters. They all had just straight tobacco. Camels, Fatimas, Chesterfields. Crazy.
So did you ever experience any shortness of breath? It sounded like you had a lot of cough in the beginning.
I did after I got married. When I was I got married a second time, married before, 27 years old. Time I was 42 or 43, I had a little in the morning. Coffee, cigarette, and that kind of stuff. And then I told you earlier that my boy had asthma or didn't like it very much, so I quit.
And this was your second wife that told
Yes,
you to quit.
right.
So back then, you probably didn't know that you had COPD.
No.
When did you first get told that you had COPD?
Well, I first suspected it. We have a little cabin up the mountains. It's about 5,000 feet. I go up there and, boy, a little bit short of breath, Well, nothing. I was very active. I played all kinds of sports. I bowled, I played softball, I played tennis. One day I went down to the lake with my wife, and I went down a hill, go fishing. Couldn't get back up the hill. It was just out of breath.
How old were you?
64, 65. So I stayed there and walked down the lake and came back the easy way instead of going up the hill. Did it fine. And then a year or so later, I belonged to a fishing club. And I went up to the high Sierras, June Lake and up near Mammoth. Got up there and same type of thing happened. Still didn't think much about it. Still wasn't diagnosed with COPD. But my mom and dad both were smokers, and my mom died at 72 from emphysema, and my dad died at 79 with lung cancer. I was almost 80 years old, and I had got pneumonia, and I went in the hospital. I was in there for about 8 or 9 days, and a pulmonary guy came in. He said, "Hey, did you realize that you have a lung disease?" I said, "No." He said, "Well, we have what's called now COPD. So I finally got out of the hospital, put me on a little breathing thing and some exercises and stuff like that. Got over the pneumonia. 2 years later, same thing happened again. Got pneumonia, still couldn't breathe again, back in the hospital, and here we are today. So,
Do you know what COPD is?
yeah, it's chronic obstructive pulmonary disease.
They teach you about the lung and how it works?
Yeah, they went through all that. I had a few nodules on my left lower lung, the bottom of my left lung, since I was 82. And then they monitor every year. I get chest x-rays and get
The nodules, yeah.
all kinds of scans. Eventually, they all went away. So now I'm clear for no more nodules on my lungs. But I still have days like foggy days or where they do a lot of insecticides. Boy, I just suffer.
You can't breathe
Yeah.
very well. So, when you look at chronic obstructive pulmonary disease, there's two different illnesses that it encompasses, right? There's chronic bronchitis and then there's emphysema. Now, emphysema is dead lung, and chronic bronchitis is really, the way that we define it is producing mucus for 3 out of 12 months for 2 years in a row. That is chronic bronchitis. But when you really think about it, it's actually inflammation of the pipes and mucus production of the pipes that are carrying air to the lung. So when you think about COPD in general, right, a lot of individuals will just throw out the term COPD and they won't think about if it's emphysema or if it's chronic bronchitis or if it's a mixture of both. The first thing to understand is how the lung works, right? And so when we explain how the lung works, we're going to get into Tom's initial symptoms of shortness of breath at altitude, we'll talk about in a second. The lung is a bunch of pipes that lead to a bunch of balloons all stacked on top of one another. That's the lung. The pipes are surrounded by muscle, and then the balloons are actually where, when you take that breath of air in, you're going to take oxygen out of the air. Oxygen is 21% of the air. You're going to put it in your bloodstream. That's in the balloon. That oxygen is going to go into your bloodstream as the red blood cells pass through that balloon. And the red blood cells pass through that balloon at a certain rate. And you guys don't think about that rate, but it's a very common rate. It's called the heart rate. The faster your heart rate is, the less time the red blood cell spends in that balloon to get the oxygen, right? So when your heart rate's going really fast, you might get a little short of breath. It's just because that red blood cell is not spending enough time in that balloon for you to get that oxygen, right? So when you look at COPD, dead lung is those balloons have popped. You just don't have it. That's emphysema, right? It's gone. Right. After the age of 35, everybody starts to lose some of their balloons. We lose about 35, 40 cc's of balloon every single year after the age of 35. So everybody's going to have some amount of emphysema as we get older. Chronic bronchitis is really secondary to smoking, right? And that's when he was saying at 19, he would smoke a cigarette and he was producing mucus and he was coughing. That's kind of like having an episode of bronchitis. Medicine is very black and white, right? And so we say, oh, you don't have chronic bronchitis unless you have productive cough for 3 out of 12 months for 2 years in a row. But in actuality, disease is very gray. So somebody might have those symptoms for just a year, and I might say they have chronic bronchitis. I don't care if it's not 2 years in a row. I really don't. So I think we have to understand that really what we're talking about with chronic bronchitis is that inflammation and that mucus production. And it sounds like, Tom, during your hospital stays where you had pneumonia, that's what you had. You had a lot of inflammation and mucus production, and that's what brought you in the hospital. Is that right?
That's correct.
And what was that like when you go to the hospital? Do you feel short of breath? There's a lot of symptoms? Like what were those things?
I had a lot of shortness of breath, and I also had AFib during that time.
Mm-hmm.
So that was a problem, getting my AFib down in order to get my breathing back. And it was very unpleasant, very, very unpleasant. But yeah, I couldn't even get out of bed. I had to use the urinal and stuff like that in bed I couldn't even get out and have breakfast, or they had to stay in bed all that time. Just was completely exhausted, completely out of breath. Dead, not dead, but dead, but,
right.
Exhausted.
So when you think about the shortness of breath that Tom was experiencing, you ask yourself, like, why does he have shortness of breath if he's living with this all the time? So again, you've got emphysema, so you've got dead lung. And so when you have emphysema, you've got less areas of balloons. So that means that the blood has less areas to go and get oxygen. So there's a certain limit, right? Most of the damage in emphysema takes place in the upper part of the lung first. It starts up here because if you can imagine, if you go outside, you light a fire, smoke rises, right? Same thing happens in your lung when you're smoking a cigarette. Smoke rises. And so all of the damage and all the balloon popping takes place up here first. But I want you guys to think about something. There's something called gravity. So where do you think most of the gas exchange and the blood flow goes? Well, the blood flow goes to the bottom. So this is why people don't really experience symptoms until 30, 40, 50 years down the line when they've been smoking for that long, because the blood flow hasn't reached the disease part of the lung. Now, when does blood flow actually reach that disease part of the lung? If you're calling on the lung to do more. So if you are going to walk up a flight of stairs, if you're going to go run a marathon, if you're going to go exercise, you're doing a couple of things. One, you're increasing your heart rate, which means that those red blood cells are spending less time in that balloon. And if you have less balloons, obviously you're going to be short of breath for two reasons, right? Because you're spending less time in that balloon and you don't have a lot of balloons to get that oxygen. And then the other thing that actually happens is because of that heart rate rise, your body knows, man, I need to go recruit some more lung. I better go recruit some more lung so I can gas exchange. And so the blood flow goes up towards the head. We call it cephalization. So the blood flow goes up here, but all that lung is diseased. So it really has nowhere to go get gas exchange. And so people get short of breath when they're doing things. Now, Tom, when you were walking up a flight of stairs or exercising, did you get more short of breath?
Oh, absolutely.
Yeah. So these are symptoms that Tom was experiencing, it sounds like, frequently.
Yep. All the time now. All the time. I can't hardly walk half a mile without having to stop, and you'd be exhausted. And it not only that, but it tires your body out too because you're laboring everything, It's really difficult. So,
And even to go a step further, you remember earlier, Tom was talking about going up to the mountains and feeling a little short of breath. And then he did it again and he felt a little short of breath again. What's actually happening there is quite interesting. So when you go to altitude, elevation, 5,000 feet above sea level, 8,000, 9,000 feet above sea level, what's actually happening to the environment? Well, here's the thing. The number of molecules in the air as you get closer to space reduces. You have the same percentage of oxygen. It's still 21%, but there's less oxygen molecules. Say there's 100 oxygen molecules at sea level around you. When you go up 5,000 feet or 10,000 feet, there may only be 20 or 50. So you've got less oxygen up there. So if you have less oxygen up there, what do you think is going to happen to Tom's symptoms? Well, he's going to start experiencing his symptoms doing things that he normally could do on a daily basis at sea level. So when he goes to the mountains, he's more short of breath.
yep.
And that's what you experienced, right? And you first experienced, that was the first thing that you felt where you were like, something's wrong here.
Right. That's exactly right. Thank you.
And so again, when you think about COPD, I guess my question for you, Tom, is when you were diagnosed, you had significant symptoms for years. Is that right?
Yep, probably. But as I said before, it depends on the quality of the air too. If you went to Banning or out there in the San Bernardino area, bad air. Back to the beach, good air. So, but again, fog affects me also. Look right now, even my voice is even changing. So,
You know, and when you're talking about bad air, really what's happening is there's more molecules in the air. So there's more pollution in the air, right? Or there's different things that are affecting his ability to absorb oxygen. So one is air pollution causes inflammation of those pipes. We know that in areas of the world where the air pollution is the worst, we know there's a lot of lung inflammation and there's also a lot of emphysema. You also have a high rate of pulmonary disease. If you look at the state of California, where air pollution was the worst, you have the most pulmonary disease. Not only that, but if you go back to the pandemic, you also have the worst SARS-CoV-2 infection and the worst COVID in the areas where air pollution was the worst. So I would expect Tom to have his worst symptoms when the air is bad. And as he gets closer to the beach, again, that air pollution isn't as present right next to the ocean. And so, we have this term called fresh air. So Tom probably likes to walk on the beach for some fresh air as opposed to driving into San Bernardino.
absolutely.
When you were initially diagnosed with COPD, did you have a certain feeling, or were you just kind of like, I expect your generation was like, okay, whatever, I got it.
No, I didn't expect anything. It was a big surprise. I mean, to say COPD, I didn't know what COPD was, But they sent you to a class. They told you how to do certain breathing exercises, and they also gave me an inhaler, which I take every day, called Brio. And that inhaler helps put particles in my lungs to help me breathe. It kind of clears it up, kind of like let's say a pump on a car, get all the bad stuff out and get the good stuff in. So I do it every day. The only problem with steroids cause you can't sleep. You have all kinds of other things happen when you start doing that kind of stuff. The skin gets real thin.
So Brio, you guys, is a long-acting beta agonist and an inhaled corticosteroid combined together.
Right.
So again, when you look at COPD, look at the management of it, One of the most important things when you look at the management of COPD is being able to understand, is your patient emphysematous predominant, so a lot of emphysema, or chronic bronchitis predominant, right? A lot of airway inflammation and mucus production. They can have a mixture too. If they're more emphysema, so more dead lung, and they don't have that inflammation of the pipe, they don't have that mucus production of the pipe, you're going to give that patient oxygen. The inhalers aren't really going to do anything because the way that we manage COPD, again, it's evolved over the course of time. But what we're managing is we're managing that airway inflammation. We're managing that mucus production. We're managing the shortness of breath as well if they have emphysema. And so here is how we actually manage it. So in patients that have COPD that do not exacerbate and they just have shortness of breath, you're going to give them a long-acting beta agonist and a long-acting muscarinic antagonist. These two medicines together are going to allow the pipes to be as wide as possible. They're going to allow for bronchodilation. The other thing you're going to do is you're also going to give these patients oxygen if they desaturate less than 88%, either with exercise or on room air. These are the two things that may help these patients. If a patient has a tendency to get pneumonia or to get exacerbations, that is, they're producing a lot of mucus, they're coughing a lot, they're in the hospital like Tom has been, your management strategy changes a little bit. This is where you're going to think about adding that inhaled corticosteroid to that long-acting beta agonist and that long-acting muscarinic antagonist, right? Or that long-acting muscarinic antagonist in the case of Tom. So you're going to add, a Brio, which is inhaled corticosteroid, and a LABA. You might add a medication called Trilogy, which is a long-acting beta agonist, a long-acting muscarinic antagonist, and an inhaled corticosteroid together. And you're going to take these medications to calm down the inflammatory response, keep the airways open so that people can breathe in air. As you can imagine, if you're producing a lot of mucus, that means that mucus is getting in the way of the air that's coming in. We call that obstruction. There are instances where that mucus obstruction can lead to a significant mucus plug and air can't get into your balloon. That causes hypoxemia, so your oxygen level goes down. This is why we don't like that significant amount of mucus production in these patients. Since we now understand what happens when you breathe in air pollution or smoke or your environment in general, you can activate the inflammatory response because you've got these cells that line your airway. And when they see things that your body doesn't like, air pollution in Tom's case, smoking cigarettes in Tom's case, you're going to activate the inflammatory response and get a rush of white blood cells into the airway. Now, when you get that rush of white blood cells into the airway, that's when you start getting symptoms. What's the biggest symptom that you have, Tom?
Well, I would probably say shortness of breath, and there's lots of times I have to do an exercise which is called breathing in through your nose, taking deep breaths and letting it come out your mouth like puff, 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 and just doing that 3 or 4 times. That then opens up things, and that makes you feel like you're not going to die
Yeah.
because you can't get air in.
Yeah.
But I haven't got to the point where I need oxygen yet, so that's a good thing too, I guess.
I think one way to look at it is, I guess that's a good thing. But then my question always is, in patients that say that, I get why they say it's a good thing. But for me, I always ask myself, yeah, okay, I get it, but would it help you, right? And so I'm kind of giving you oxygen. Would it make sure that you don't have to stop if you're walking back to your car or you're walking through the grocery store or whatever? That's what I wonder about in my head.
I don't know if it would or not. I've tried the other inhalers, and I've tried oxygen for a while, only in the hospital, but I didn't notice a big difference.
Yeah, you wouldn't notice a big difference laying in bed in the hospital.
Right.
You
So,
might notice a difference when you're doing something, but that's neither here nor there. It's not a big deal. Have you had a recent experience with COPD?
well, I have it every day in some form or another.
Ever been in the hospital recently?
No, haven't been in for 8 years.
Oh, that's good.
Yeah, it's been real good. So during the pandemic, I had to be super careful because my immune system was really imposed, and threatened a lot. So I stayed indoors a lot and didn't go to a lot of functions that I'd normally be going to keep away from that. Not only because if I got it, I may not be here. A lot of people that have that were gone. We lost a lot of friends during that time.
Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. This week's question: Dr. Rutland, what are the side effects I should really be watching out for with my COPD medications? Let's just talk about inhaler medications here. So we're talking about inhaled corticosteroids, long-acting beta agonist, long-acting muscarinic antagonist. If you're on these medications, inhaled corticosteroids can actually lead to pneumonia because they suppress the immune system. When you look at long-acting muscarinic antagonists, these medications can lead to dry mouth, urinary retention, and even blurred vision in some instances. And when you look at beta agonists, side effects of these might include a paradoxical bronchospasm and also have to pay attention to individuals with heart disease. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save. You know, what I want you guys to understand is when you have a lung disease, especially an inflammatory lung disease, right? And a lot of my patients have an inflammatory lung disease. So what you've got is this activation of the inflammatory response into the lungs. You got all these white blood cells in the lung. So they are taking up space in the balloons. They're taking up space in the bronchioles, the pipes carrying air to the lung, right? That's always there. You've got mucus that's always there if you have this inflammatory condition like Tom had. Just imagine getting an infection on top of that. Whether you're getting SARS-CoV-2, whether you're getting influenza, whether you're getting respiratory syncytial virus, all of those infections further activate an inflammatory response. When you further activate an inflammatory response, you get a rush of more white blood cells into the area. So now they're taking up more space. You get more mucus production. And so these individuals exacerbate from their illness, and they're at risk of death because your lung is an end organ. There's no other organ in the body that's going to exchange oxygen for you. There's no other organ that can do that. And so when you have an inflamed lung at baseline, getting an infection on top of that can be life-threatening, which is what Tom is telling us, right? And so I think we have to understand that when you have these conditions, protecting yourself from the infection is really important.
It is very important.
Were there friends of yours that you knew had chronic lung conditions and you were really worried about them?
No, there was a few that were, some that weren't. But we had one case, we had a couple who both had cancer at one time. They both survived the cancer. That was probably 3 years before COPD. And COPD came along and took away his wife after all that time. And she went in, never came out. He never got to see her ever again. So there was other couples. We live in a retired 55 community where we see a lot of seniors, and we see a lot of this death and COPD and all kinds of stuff, So we experience a lot of that every day. So we try to be as careful as we can.
Yeah.
And not get too big of crowds or get exposed to any kind of outside infections.
Yeah.
Pneumonia, all the shots that we get for different things.
So you get vaccines?
Oh, yeah. Every vaccine I get, I take,
Yeah. Have you ever had a reaction to any vaccine?
I had a little reaction to the first COVID shot. My wife had a worse one. She never smoked in her whole life, but yeah, I did.
Like a rash or like a fever?
Oh, yeah, fever for a couple of days
Yeah.
and really, really tired and had to stay in bed for 2 or 3 days. But I've had tested positive for COVID a couple times and no effect.
Did you ever take a medicine for COVID? Did you ever take Paxlovid or anything?
No, never took
Yeah,
anything.
you've been fine with that.
Yes.
So when you think about the lung, everybody, like one of the analogies I always like to mention is I always like to talk about Disneyland. So when you go to Disneyland, right after you've spent your $1,000 and your kids have ridden all the rides, right? And Disneyland's trying to suck more money out of you. You go to the gate and you see the gentleman that's holding all of the Mickey Mouse balloons, right? You've got one guy standing, holding up the stem of these Mickey Mouse balloons. That's essentially the basic unit of function of the lung that we call the secondary pulmonary lobule. The guy represents the pulmonary artery. The stalk of the balloons represents the airway or the bronchiole, and then the balloons represent the alveoli. Now, just imagine that you have a fence around this guy, right? Say it's a white picket fence that's shaped like a pentagon. That is what the lung represents. And so what I want you to think about for COPD is this. One, imagine those balloons are popping one by one, right? That's emphysema, that's lung damage. That's one thing. Now imagine that you've got a crowd of people around the stem of that balloon. That's inflammation. That's chronic bronchitis, okay? Now let's pretend that Goofy comes over and represents an infection, right? If Goofy comes over, what's going to happen? All these kids are going to try to rush into that fence too to see Goofy. Well, what's going to happen in there? It gets really hot and sweaty and people don't like it. That's inflammation of the lung, right? That's like an exacerbation of COPD. Not only do you have inflammation around the pipe, but you got inflammation in these balloons, and that's a problem. So now what I want you to do is take a step back a little bit, because Tom said that he had atrial fibrillation. He said AFib. Atrial fibrillation is an abnormal heart rhythm in which the most dangerous thing really about it is that your heart is just beating so fast. It's fibrillating. It's beating, 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 beating. Remember what I said earlier. The faster your heart rate is, the faster those red blood cells run through those balloons. They don't spend enough time. You don't get oxygen. This isn't like a normal balloon. Now just imagine an inflamed balloon. And why does that happen? Well, it turns out you've got two sides to your heart. You got the right side of your heart. You got the left side of your heart. The right side of your heart collects the blood from your legs, from your head, goes through the right atrium into the right ventricle, which pumps blood to the lung. That's the lung that needs oxygen. So it's pumping blood into the lung. If you have inflammation in the lung, if you have less lung because you've lost it because of emphysema, you've got dead lung, you've got less tissue, that right heart gets a little bit bigger because your blood, the amount of blood in your body hasn't changed. So it gets a little bit bigger and it feels that pressure. Your right atrium feels that pressure too, and it almost starts to stretch out a little bit, which is right near your superior vena cava, which is what's draining your blood from your head into your right atrium. That's where kind of your pacemaker cells live. And when they get stretched out, they start tripping. They're like, what's going on? And they start just firing. That's atrial fibrillation. And so that's why lung disease, especially lung disease like emphysema or chronic bronchitis, is related to atrial fibrillation. It's because of that stress that the right side of that heart actually feels. And so that's one of the things that can happen is these individuals can present with atrial fibrillation, which again, for me, is almost like a normal rhythm that can happen to individuals that have the amount of life experience that Tom has. Like it's something that happens. So this is why controlling that lung inflammation, that mucus production with medication is important. And we're going to get into the evolution of that in a moment. But before we get there, I want to ask you some questions because I think that you just don't have the opportunity to sit with somebody who's been here since the 1930s, right?
Thank you.
So my first question is, what's your most favorite decade that you've lived through?
I would probably say right now the last 10 years of my life, because my wife and I have been married 63 years.
That's amazing.
Perfect marriage, and the golden years. We both are fairly healthy other than COPD. We're not broke, we're not wide walkers, we're not hearing aids. Well, maybe a little bit hearing. But yeah, I would say that this last 10 to 15 years has been outstanding. The other ones were great, but the kids are all gone. You don't have the responsibility, and
So you get to get down and do whatever you want around the house and all that kind of stuff.
yeah, and we both get along so well, so it's a good thing.
Define the perfect marriage. It was interesting that you said that.
Well, I just told you the perfect marriage.
Me and my wife for the perfect
Yeah,
marriage.
no.
Are there three things? If there are three things that you could tell me, give me advice, about having a perfect marriage, what are the three things that I guess?
Your best friend, your lover, still is a lover after all those years, and just getting along. It's just, good morning, honey, how you doing?
Just living life. Like,
life.
she's like, hey,
Yeah, if we die tomorrow, be very, very sad because this is a good time. I enjoyed the kids. I enjoyed raising them. I enjoyed being single. I enjoyed all the years in between, but this is the best.
So I asked the favorite decade. What's the most memorable decade?
I would say the first 10 years of our marriage, because I married a girl with 2 kids. We had 2 kids like that. So here I am.
What decade was that?
Well, that was 1963 to 73. And it was hard. You have to give up everything you have, all your single life, all your everything. You got to give everything up for yourself and take care of the family. But it's hard because here you got 2 little kids. You don't know where they came from in the background. Although you love them, I adopted them. I don't know. It was hard. It was hard, but it was still good. So,
what's a song that always brings back memories?
You're the apple of my eye.
Oh, nice.
To my wife. And I also love. Now I always love Stevie Wonder with "I Just Called to Say I Love You."
Oh, nice. That's a great song. I just go. I love that song.
That's like that. Yeah, I play it. I used to call from work, and
Yeah.
when I was still working, I'd put it on my phone and send it to her, and it was just a loving thing, you know.
Yeah. Who's funnier, you or your doctor?
I would say I am. My doctors are pretty serious. It took a while, but every time I get a new doctor, I call breaking them in.
Yeah.
They're always so serious. They only got 5 minutes to spend time with you. I always tell a joke, and I always tell the nurse a joke to get started with something. And
What's the joke? What's your go-to joke?
oh, okay. What do you call 10 rabbits walking backwards?
I don't know.
Receding hairline. Okay, one more is my favorite first joke I ever told.
Okay.
Not the first joke, but the two silkworms, they wanted to race each other. Problem is they ended up in a tie.
Both those jokes take a second.
I gotta think.
Yeah. That's pretty
Okay.
funny. What's something you understand about your body now that you didn't know when you were younger?
I never thought I'd never be hurt this bad.
Oh, man.
I never thought that I wake up with this, can't move that. I had to give up a lot of sports when when you get older. You just can't do the stuff you used to do.
Yeah.
Yeah. I miss that a lot. So, miss tennis. I miss fishing. I miss horseshoes. I miss softball, all the sports I played.
You know, my grandfather said the same thing. It was one of the last things he said before he died. He said, the old boy ain't what he used to be. He not even what he used to thought he was. That's
Something like that, yeah.
That's what he would say all the time.
Well, my wife's father had a good saying also. He said, I don't mind getting old. It's just didn't have the pain.
Mm.
So he was 84 when he died, but he said he was always a happy-go-lucky guy.
You know, my grandfather had COPD, and that's what he died from.
Really?
He was 87. Yeah.
Wow.
He died 11/27/05. He was like my dad. And it's funny because when he said something like that, he's like, I don't mind dying. I just hate to be given a ticket. And he felt when he got the COPD, it was like a ticket, like
Yeah.
here,
Well, I've been very blessed in that area, so you figure I've probably had it years before that, but 90 years old, pretty good.
Do you feel like doctors now? So my grandfather would go to the doctor, and he said he would walk into the doctor. He said rarely the doctor would be looking at him, right? Because he'd be a new doctor. The doctor's on the computer now, typing away. And then my granddad would say, I'm short of breath on this or that and the other. And then the doctor would say, okay, listen. And he would say, wait a second, how old are you? And then my grandfather would say 86. He'd like, man, get out of my office.
Get out of here, right?
And then, yeah.
That's it.
Yeah.
Yeah. I have a personal relationship I've had my pulmonary guy for 10 years since I had
COPD.
pneumonia, and I've had my MD for 5 years. The only other guy I see is I have a bit of a bad rash right now I'm getting over with. I've had him for 2 years, so.
What's the best advice you've ever received from somebody in your life that actually stuck?
I would say stop smoking. Stop smoking, stop smoking, stop smoking. I have a son-in-law who's French. I kind of convinced him that he could quit smoking. He's the only one in the family that still smokes. And all of his people, when they come from France, they all smoke.
They're all smoking.
They can't quit for some reason.
Well, what's funny is in France, they don't smoke like we smoked here. They don't smoke 30 cigarettes a
No,
day.
my son-in-law does.
Oh, he does?
Oh,
He
yeah.
still does? What's your secret to living well at 90?
I guess it's just genes, in the genes. I don't know. I wanted to outlive all my family, all my dad's family. I wanted to be the oldest Gill still alive. So far, I'm 3 years ahead of that. The last one was 87 when he died. So my dad died young. All his brothers died at 82, 83. Of course, they smoked when they were 6, 7 years old. That's the things they did in those days,
Well, they were born in the 1800s.
So,
Right? I mean, I just think it's just...
yeah, that was my goal. My goal is to really to live to be 100, but I don't think I'll ever make that. But
I think you're on the way.
maybe. That's what everybody says, but we'll see.
I think you're
We have, where I live, we have 3 centenarians, 2 guys and 1 lady. One's 102, one's will be 103 this year, and the lady is 101. And we have a few that in the late 90s. So out of 2,300 people,
You live in like a senior community?
yes,
That
Yeah.
community's doing a fantastic job.
yeah. It's a very good. It's an old place, but it's beautiful. It's the only hidden treasure in Huntington Beach.
Do you think that's one of the strategies that's helped you deal with COPDs, living in that community?
I can't say that completely, but it's part of it. Yeah, it's part of it.
Are there any other strategies that have truly helped you?
My wife, especially. She takes, a guy that doesn't have a wife probably doesn't take as good a care of himself as a person who does have a wife, because your wife, if she loves you, she's always looking out for you. Go to the dentist, go to the skin doctor, go have that checked out, do this, make sure you do this, make sure you eat properly. Where other guys, if you're single, they get big fat bellies. They don't take care of themselves. Their face looks like the wife is important in your life, very important. In my life, it is. Now, my buddies that I have close, like Ted and Wally and Pat, they all have lost their wives, but they were at the point of their life where they take care of themselves still. But if you lost your wife when you were 60, there's so many guys where I live that are, they wonder why they can't get a date. They don't take care of their body hygiene-wise. They don't take care of their face hair-wise, and the wife is important.
Wow. I'm going to tell my wife that when she gets off the plane today.
Yeah, I'll tell her. We tell her I want to talk to her. No.
I'll tell her. You can talk to her. You can tell her.
No, I said to stay married. If you got some rough times, we had rough times. We got through all of them.
How did you get through the rough times?
A lot of prayer, and we had a couple of times of counseling. Just get through those times, because a lot of guys, people get divorced, too late then. Never better on the other side. Get through the rough times, perfect life now.
That's what I always tell my friends and tell myself, the grass is never greener.
Nope, it never is. I saw an old picture once. That guy did our income taxes. He had a square picture with 4 green spots, and he had 4 cows, all in the opposite thing. The grass was never greener on the other side, any better on the other side. And I always remember that, and that's true.
When you think about COPD, because we've been talking about it, there's this side of COPD that we manage with inhalers and we manage with oxygen. But since we now understand how our white blood cells respond to the environment, right, and how the white blood cells are the cells that protect our body, we now can apply certain types of inflammation to COPD. And there's actually newer medications that can be used to treat individuals that continue to have exacerbations or continue to have attacks from their COPD, people with pneumonias. It's interesting hearing you talk about your COPD, because you quit smoking 50 years ago. 45 years ago. And you didn't get diagnosed until 30 years later.
Right.
Hmm. So for you, have you ever you've had a CAT scan? The other thing you mentioned pulmonary nodules.
Yes.
Right? You said you had pulmonary nodules.
Right.
Do you know what pulmonary nodules are?
No. growth of some kind, I guess.
Yeah, no. So nodules, right? So again, remember, your lung is one of the only organs that's constantly exposed to the environment.
Okay.
And you inhale stuff all the time. So sometimes when you inhale stuff, if you inhale a lot of dust, your lung is like, wait, what is that? The immune system goes over there and it just kind of covers it up and creates this inflammatory pocket around it. It looks extra white on a CAT scan and sometimes on an x-ray. And when you see it, if it's any well-circumscribed lesion that's less than 3 centimeters in size, we call that a nodule. Now, in individuals, when it's less than 1 centimeter, we'll watch it and we'll say, okay, we're going to watch this for 2 years. If it grows at all, I'm going to biopsy it or I'm going to take it out. Right?
Right.
That's really that's the advice that we give people for that. If it's above 3 centimeters, we call that a mass, and that's something that needs to come out, or we need to biopsy it and figure it out. In between, it's kind of like the art of medicine. How are you going to do this? Are you going to get a CAT scan in a couple of months, make sure it doesn't grow? What are you going to do? But these are all things that it sounds like you've gone through as well, because you've had multiple CAT scans.
Yes, I have.
And now you said you're clear,
right? Because
the nodules went away.
Correct.
Yeah. When you got diagnosed with COPD, you just went to the hospital, right? You just
911.
911.
Yeah, because I felt I was on the sofa and I wasn't getting up. My wife said, didn't even tell me. Next thing I knew, the paramedics were there taking me to the hospital. So wow. I was almost completely out of it. If they hadn't have come, I probably would not have made it.
And you had an x-ray or a CAT scan?
Had all that. I had CATs, had x-rays, and hooked up to 45 different machines and all that kind of stuff. So I went from 150 down to 135. Now I'm at about 129. But I feel good all the time at this weight. I like being, one time I weighed 170, but that was in the young days when I was muscular.
You're talking about weight loss, so you've lost a significant amount of weight since.
Yeah, that was back. I've had the same weight for 7-8 years now.
Nice. Typically, when we're diagnosing COPD, there's a couple of things we do. We'll do the breathing test, which shows us airway obstruction.
Right.
Take a big breath in, blow it out. If the air comes out really slowly, it's obstructed. Airway obstruction, we'll either give you a diagnosis of COPD or asthma based on what we think. We do the CAT scan or the chest x-ray. The chest x-ray may show a lot of air in your lung. Hyperinflation, air trapping, again, can be asthma or COPD. On a CAT scan, that's where the money is for me. You can see emphysema on the CAT scan. You can see dead lung. You can see inflammation. You can even see mucus plugs on a CAT scan as well. And so for me, CT is really like the gold standard in my practice for diagnosing COPD after somebody has already been diagnosed with airway obstruction.
Are you trying to get business to get me over to you now?
No.
I'm just kidding.
You got a great doc.
I do.
Yeah.
He's good.
You've done really well. You haven't been in the hospital now. If you've been in the hospital every month, yeah, I'd be like, hey, you can come to my office. So we talked about therapies, right? We talked about the inhaler therapies where you're going to use inhaled corticosteroids. You're going to use long-acting muscarinic antagonists. You're going to use long-acting beta agonists to calm down the inflammation of the airway, to make sure that the airway is as open as possible. And then now that we understand the immunology of COPD, and we also understand that sometimes you don't really all the way bronchodilate with the LAMA and LABA, there are newer medicines. One of the newer medicines is called ensifentrine, which is a medicine, or Ohtuvayre, which is a medicine that not only allows for bronchodilation, but it also can calm down the inflammatory response. You've got dupilumab, which again calms down the inflammatory response and the cell recruitment, calms down mucus production. You've got mepolizumab, which calms down the inflammation, calms down the eosinophil, not allowing it to lead to more inflammation. These are the advanced kind of therapies and medicines when it comes to your condition, Tom, to COPD. Other things, right, so that people are doing. So when you have dead lung, some people think that stem cells, giving somebody stem cells in their system will lead to an increase in lung tissue. It doesn't.
Really?
Yeah, that's what they think. It doesn't. It's not been proven. We don't know how to do that yet. We're getting there. We're not quite there yet. Trust me, when we get there, I will be doing it, but we're just not quite there yet. Other things.
In the next 5 years, please.
We're trying.
Okay.
We're close.
Okay,
We're
good.
close. Other things we do is when you have emphysema, and remember earlier that I said that most of the emphysema takes place in the upper part of your lung.
Right.
So what can happen is when the upper part of your lung has dead lung, all of the air up here gets trapped. You got healthy lung down here. And so you're putting pressure on the healthy lung. So the healthy lung almost becomes what we call atelectatic, and it can't expand as much because it can't get through the pressure of all the dead lung that's holding on the air up here.
Okay.
So what we do is we actually go in with a bronchoscope. We put in what's called an endobronchial valve. So we put in a little one-way valve that lets the air go out and the air can't go back in.
Really?
And so the air goes out. Yeah. Unfortunately, when you do that, 1 out of 3 times, 30% of the time, somebody will get what's called a pneumothorax, which is they'll get a little hole in their lung because the dead lung will start to involute and it stretches out the tissue and you get a little hole in it. And it's called a pneumothorax and lung collapses, right? So you put a little tube in, you let it heal up. It takes a while. But again, if you get the bad lung, the dead lung, to kind of collapse, it allows the healthier lung to expand again.
Really?
Yeah, and people have some improvement on that. So that's another newer therapy. So these are the things that we think about when it comes to, your lung specifically and your lung disease, but you're being managed really, really well.
Well, thank you. I'll tell them that.
Yeah. I appreciate you coming on the show today. It's been absolutely wonderful. Do you have any tips for caregivers or for doctors or spouses out there?
Yeah. Don't smoke. And pay attention to your doctors. If your doctor says if you don't feel comfortable, it doesn't hurt to get a second opinion. I never did get a second opinion because I always got doctors that would take care of what I had. And just like you, I feel, only being here for a short time, I always feel comfortable with you already. So that's good. Thank you for that.
Thanks a lot, Tom. I appreciate the compliment. Again, I think the most important thing for people to understand is, COPD encompasses chronic bronchitis and emphysema. If you're short of breath, there's a pathway to go along for inhaler management. If you have chronic bronchitis, there's a pathway to go along for inhaler management, and then you have the opportunity for biologics like Dupixent, Nucala, and even ensifentrine to control some of that bronchodilation or bronchoconstriction and control some of that airway inflammation. Again, go seek help. If you feel like you need more or you want to say something else to your physician, like Tom said, you can go get a second opinion. Doesn't hurt us. No big deal.
Right.
Go get it. But we want to make sure that you're feeling better. We want to make sure that you're on the right path. We don't want you in the hospital. We don't want you in the ER. We don't want you in the urgent care. We want you to be at home with your family, in your perfect marriage, with your loved ones, as much as possible. Thanks again for watching, you guys. We're on Instagram at the Health Exchange Podcast. Get us wherever you get your podcasts every Thursday, 6 a.m. Pacific, 9 a.m. Eastern Standard Time. Follow us on YouTube, Apple, Spotify, iHeart, wherever you get your podcasts. We'll see you then. Thanks again.
Thank you.
Appreciate it.